Gina. I'm the student nurse that's going to be helping you out today. Can I get your name and date of birth?
Millie Larson, 12/14/49.
And do you have any allergies, Millie?
No.
And any medical conditions that I should be aware of?
No.
No? Okay, I'm just going to check that with your chart. And check your wristband. Okay. Before we get started, I'm just going to be asking you a couple of funny questions, so just bear with me. Can you give me your name one more time?
Millie Larson,
And Millie, do you know where you are right now?
Concordia Hospital.
Okay, and do you know what day it is?
Thursday.
Thursday. And do you know who the President of the United States is?
Joe Biden.
Okay, patient is oriented ×4, no signs of slurred speech or involuntary movement. Okay, so what brings you in today?
I was gardening yesterday and I tripped and rolled my ankle.
Okay, and are you in pain?
I would say it's 3 out of 10.
Okay, so on a scale of 1 to 10, it's a 3.
Yes.
Okay, and have you found anything helps or exacerbates the pain?
When I walk, it's about a 5.
Okay, so walking makes it hurt a little bit more. Have you been taking any medication to make it better? No? Okay, and is that pain that you're at right now, is that tolerable for you, or you have a pain goal?
I would like to be like around a 1.
Okay, that makes sense. So we'll figure out what we can do with your visit today to get that pain down. But while we have you here, we want to do a head-to-toe assessment to get to know you a little better. Is that okay?
Yes.
Okay, so we're literally just going to work head-to-toe and assess your whole body.
Okay.
So I'm going to start up here with your head. Okay, so I see no signs of alopecia or dandruff. Head looks symmetrical. While I'm here, I'm going to check the skin on your coccyx. I don't see any signs of skin breakdown, and skin color looks regular for ethnicity. Okay, since I'm over here, I'm just going to look inside your ear, okay? Okay, no excess cerumen or skin breakdown for both ears. Okay, we'll move on to assess your eyes. I'm just going to shine a light, okay? Okay, and then I'm just going to pull down a little bit to check down here. So sclera is white, no signs of jaundice, and conjunctiva is pink and moist. And then I'm just going to have you follow your eyes, try not to move your neck, okay? Okay, patient's eyes are perla, pupils equal, round, reactive to light, and accommodating. Now I'm just going to move on to your nose, okay? If I could have you just tilt your head back a little bit. Okay, I don't see any polyps or excess drainage in the nose. And now we'll move on to your mouth, so if I could have you smile. Okay, and then open your mouth wide. Stick your tongue out. Say, oh. Okay, and Millie, do you wear any dentures?
No.
No? Okay, what about any glasses?
No.
No? Okay, so the mucous membranes in the mouth looked moist, no ulcerations. Okay, so we're gonna move on. I'm going to just check your swallow reflex, okay? So if I could just have you swallow. And do you ever have any difficulty swallowing?
No.
No? Okay, no signs of dysphagia or tracheal deviation. And then I'm just gonna take your carotid pulses. Carotid pulses are 2+ equal bilaterally, and then I'm going to take your temporal as well. Okay, temporal pulses are 2+ equal bilaterally as well. Okay, and then we're just going to move on to the lower extremities. So just let me know if you feel this.
Mm-hmm.
Okay, sensation is intact in the upper extremities. I'm going to take your brachial pulses, okay? Okay, brachial pulses 2+ equal bilaterally. and radial pulses 2 plus equal bilaterally. And then we're gonna assess for range of motion. So if I could just have you here and let's do like the YMCA. Okay, thank you. Range of motion upper extremities is active, and I don't see any signs of skin breakdown on the elbows. Okay, now we're gonna move on to assessing your chest area, okay? So first I'm going to listen to your heart sounds and then we'll move on to your lung sounds, okay? Okay, so this is your aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm just gonna hang out here for a little over a minute, okay, so we can get your apical pulse, which is located in the 5th intercostal space. Okay, so while I was listening to your heart sounds, I found that your heart rate was 80 beats per minute, and I also listened to your, I got your respiratory rate as well, and that was 14 breaths per minute, and there were no adventitious heart sounds, and S1 and S2 were present. And then now we will move on to listening to your lung sounds. So I'm gonna have you inhale and exhale at every point I listen, on the front and on the back, and if at any point you feel faint or dizzy, just let me know, okay?
Mm.
So we'll do 6 points in the front and 8 in the back.
Okay.
Are you doing okay?
Yes.
Okay, there were no adventitious lung sounds. Can I have you take a deep breath in and out, in and out. Okay, chest was equal rise and fall, so no signs of flail chest. Oh, I'm gonna assess your skin turgor. Okay, I'm just gonna give you a teeny pinch. Okay, so no signs of tenting. The skin looks hydrated. And then let's assess the strength in your upper extremities, okay? So put your hand to mine, press, and then can you pull? Okay, so strength in the upper extremities is 5. And then let's, also I'm going to check your capillary refill, okay? Okay, cap refill is less than 2 seconds in all 10 fingers. Okay, we're gonna move on to assessing your abdomen, but before we go ahead and do this, I'm just gonna ask you a few more questions. What does your diet normally look like?
So I typically like to eat 3 meals a day. In the morning, I like to have like oatmeal with some fruit. For lunch, maybe I have like a salad or a sandwich, and then for dinner, I probably have some like chicken, rice, and some vegetables.
Okay, that sounds good. And are you drinking fluids?
I drink about 2 cups of water a day.
Okay, do you maybe not like the taste of water?
Yeah, I just find it like not very exciting.
Yeah, I get that. I normally like add lemon to mine just to make it like a little bit more like enjoyable. So I get that, but we do want to have your fluid level ideally at like 8 cups per day.
Okay.
Okay, and then also, when was your last bowel movement?
My last bowel movement was yesterday night.
Okay, and what did it look like?
It was brown.
Brown, okay. And how often do you have a bowel movement?
About once a day.
Okay. Also, what about with urination? How often are you urinating every day?
Like 4 to 6 times a day.
Okay, got it. Do you have any like pain, any burning when you're urinating?
No.
No, and what about, do you notice any odor ever?
No.
No? Okay. Okay, so I'm just gonna have you lie down so we can assess your abdomen, okay? Okay, is it okay if I just pull this up a little bit? And Millie, do you have to urinate right now before I'm gonna eventually palpate the bladder?
Yeah, I'm okay.
Okay. Okay, upon inspection, I see no signs of bulges or masses, and the abdomen is non-distended. I'm going to listen to your bowel sounds, okay? Okay, bowel sounds are normal, hypoactive, in all 4 quadrants. Now I'm going to be palpating. Do you have any tenderness in the abdomen?
No.
No? Okay. So I'm going to start light. Just let me know if you feel any tenderness in any of these areas, okay?
No.
Okay, and then I'm going to go a little bit deeper. Okay, I don't feel any masses or bulges, and patient reports no signs of tenderness. And then I am going to palpate the bladder, okay? The bladder is also non-distended. I'm going to pull this back down. I'm going to help you up, okay?
Thank you.
Okay, and then we'll move on to assessing your lower extremities, okay? Let me know if you can feel this.
Yes.
Okay, so sensation is intact in the lower extremities, and then I'm gonna feel for your popliteal pulse. Okay, it's a little bit weak, but that's normal. You could just relax. You could just relax. No. Actually, I'm gonna assess your strength before we move on to working with your feet, just for sanitary reasons. Okay. So first, I'm gonna have you just try to press up on my hand. Okay, perfect. And then we'll move on to your feet. Okay, press down like it's a gas pedal, and then try to press up. Okay. So strength is 5, and now now I'm going to feel for actually the pulses on your feet, okay? Okay, post hip pulses are 2 plus equal bilaterally. And dorsalis pedis 2 plus equal bilaterally, and then I'm just gonna check the cap refill on your feet, okay? Okay, cap refill in the feet is less than 2 seconds in all 10 digits. Okay, and do you ever like need any assistive devices, or do you feel like you can move around?
I feel like I can move around.
Okay, I'm just gonna help you up for safety. You step it down, and then if you wanna just hold on right here for safety, we're just gonna look at the range of motion in your lower extremity. So let's just kick out. Perfect, and then left side, and you can kick back, and kick back. Okay, patient has full active range of motion in the lower extremities. And now we're just gonna be assessing like your balance and your gait. So I just am gonna have you walk for me, just a few steps. Okay, gait does look steady, just a little bit of weakness in the ankle that's injured, but that's okay, we expected that. So just like a little overview of like everything we went over. So the CNA I know came and did take your vitals, and your temperature was 98.8, BP 146 over 84, and then the O2 stat was 97. Let's see what else. You came in for the pain. Doctor did prescribe 400 milligrams of ibuprofen every 6 hours as needed, okay? We're gonna have you rest and just elevate that ankle, and then you can also apply ice like every 20 minutes, a few times a day. And we would like you to come back in 2 weeks and just do a follow-up with us.
Okay. Sounds good.
Okay. Do you have any other questions for me?
No, thank you so much.
Okay, thank you. It was really nice to meet you.
You too.